Hi there.
Hi.
Hi, my name is Maggie. I'm one of the first year emergency medicine residents at McMaster. Can I confirm your name and your date of birth, please?
Yeah, my name is Eva, and my birthday is in 1998.
Perfect. Nice to meet you, Eva. So, Eva, today I've been asked to perform the knee exam on you. Would that be okay?
Yeah.
So for this exam, you're dressed perfectly, so ideally the patient is dressed in shorts. I will need you to remove your shoes and socks if that's okay as well. That would be great. And while you're doing that, I'll just ask my examiner for the patient's vital signs. Excellent. Okay, great. And before I start, Eva, I just want to ask, are you having any pain in either knee today?
Not right now.
Not right now? They both feel okay? And you're comfortable walking on your own?
Yes.
You don't feel unsteady on your feet at all? That's great. Okay, so if you can just walk from me, why don't you start at the back of the room here. Just walk over towards my colleague there. So here I'm just inspecting the gait. You can turn around. Excellent. So I'm looking for an atalgic gait. I'm also looking for hyperextension, knock-kneed, bow-legged, or excessive flexion of the knee. Okay, so next moving on to inspection. So here I'm looking for a few things in the back of the knee and in the front. First, I'm looking for swelling and erythema. I don't note anything in the back or in the front. I'm also looking for deformities, which include bow knees, knocked knees, hyperextension, or hyperflexion. I'm also looking for atrophy of the calf muscles, hamstrings, and the quadriceps, which I do not note. And finally, looking for any skin changes or scars, particularly in the front of the knee, which could indicate the patient had a previous operation. I don't see any scars there. Next, I'll move on to palpation. So Eva, for this part of the exam, I'm going to be using my hands just to feel different parts of your knee to assess for areas of abnormality.
Okay.
I just want to confirm that you don't have any pain in either knee.
No.
Again, okay, excellent. So I'll start with temperature. Using the back of my hands, I'm going to compare the knees together, starting with the patella, feeling the temperature there. And I want to confirm how that feels compared to the thigh and the tibia. The patellas bilaterally feel cooler than the thigh, which is normal. And they also feel cooler than the tibia, which is normal. So next I'm just going to palpate the patella to assess for any pain. So Eva, just let me know if you do feel pain while I do this, okay? Mm-hmm. So using my thumbs, I'm just going to be feeling around the patella. See if there's any tenderness there. And I'm going to be careful to make sure I can ballot the patella, make sure it's nice and mobile, which it is. Same on the other side. And both patella are ballotable and mobile. And then while I'm here, palpating the back of the knee, mainly feeling for swellings here. For example, a Baker's cyst. I don't feel any swellings in the popliteal fossa, and I can also palpate for the popliteal pulse. And again, just looking for feeling for any bursae, which can often accumulate underneath the patella. Okay, next, Eva, if you want to just bend your knees for me and put your feet flat on the bed. Perfect. This gives me a better view of the epicondyles. So just with my fingers, I'm palpating here to feel for any deformities and making sure to watch my patient to see if she has any pain. Any pain here?
No pain.
Good. So that's the medial lateral epicondyle of the tibia and also of the femur. And same on the other side. Okay. Next, Eva, can you cross this leg over this one to make a figure of 4 position? Great, and just relax that knee as much as you can. So I'm just palpating laterally for the lateral collateral ligament, and it does feel intact. Okay, you can straighten this leg out. I'll move on to palpating for effusions of the patella. There are a few different ways to do this. I'll start with the milking test. So just milking some fluid down the thigh, if there is any, and then milking any fluid across laterally, and then pushing it back to see if anything accumulates in the medial fossa, and there's no fluid there. Next, with the fluid ballotment test, I'm just going to be palpating on both the lateral and medial sides of the patella to feel for any pockets of fluid, and there's none. And then finally, patellar tap. So again, putting a bit of pressure above the patella and just tapping down with 2 fingers to feel for any fluid motion underneath the patella. And there's no fluid present with any of those tests. Okay, so next, Eva, I'm going to test your range of motion. I'm going to do this actively and passively. I'd like to start with active. So Eva, next, if you can just with this leg, I'd like to see you bend it all the way in as far as you can go. So here we have flexion, and then extend it all the way out, and extension. And same with the next leg, please. So flexion, extension. She has excellent range of motion. And now if you can, I want you to bend your knee to a 90-degree angle again, and just hold your foot up in the air for me. I'll support you. And then if you can, you just move your toes in. Good. And so this is internal rotation. And now move them out. Perfect. That's external rotation. You can relax this leg, and we'll do it with this leg now. So I'll support you. Move your toes in, please, or out. That's okay. So in, that's internal rotation, and out, and that's external rotation. Okay, great. Excellent. And again, a full complete assessment would include movement of the patella. So I'm just making sure it moves laterally and medially. Perfect, and it's very mobile on the right and also on the left. No abnormalities there. So next I'm going to do passive range of motion, where I will move Eva's knee for her. So Eva, just try and relax your legs as much as possible. Let me take the weight, okay? I'm just going to move your knee for you. And I'm keeping my hand on the knee to feel for any crepitus. So flexion, extension, a little bit of crepitus there. And then we have internal rotation, external rotation. Excellent. And we'll compare with the other knee. Again, hand on the knee, feeling for crepitus. So flexion, extension, just a tiny bit of crepitus. Internal rotation and external rotation. Great. Okay, Eva, so next I'm going to test the power of the muscles around your knee. Okay, so I'm going to be doing some pushing, and I want you to push against my hand. Okay, so first I'm going to test for the power of extension. So Eva, can you push against my hand? Push away from your bum. Perfect, excellent. And same on this side, push against my hand. This is extension, and relax. And now with my hands behind your calf, can you pull your foot in towards your bottom? This is flexion. Excellent. And pull your heel in towards your bottom. That's flexion as well. Eva has 5 out of 5 power bilaterally for flexion and extension on both knees. Okay, so next I'm going to move on to the special tests. I'll be starting with tests for the anterior and posterior cruciate ligaments. So Eva, these tests test the ligaments in your knee, the tiny ligaments. Just let me know if you feel any pain with any of them.
Okay.
Okay. So first I'm going to start with the anterior drawer test. So with the patient's knee flexed like this, I'm going to be placing my hands on the tibia, getting a firm grip, and pulling the tibia out towards me. And I'm just feeling for any laxity and movement of the tibia anteriorly, which I don't feel. I'll do the same on the other knee. So the anterior drawer test is negative bilaterally. Next I'll move on to the posterior drawer test. This test for the posterior cruciate ligament. Similar to the anterior drawer test, I'll be putting pressure on both sides of the tibia and pushing posteriorly to feel for any laxity of the tibia that could indicate a posterior cruciate ligament tear. And I don't feel any laxity there. And similarly, on the left side, I do not feel any laxity. So the posterior cruciate ligament is intact. Finally, there's also the Lachman test. This is another test for the anterior cruciate ligament. I'll be stabilizing the femur with one hand, and with the other hand pulling against the tibia. Again, feeling for any laxity. which I don't feel. So bilaterally, the anterior cruciate ligament and the posterior cruciate ligament appear to be intact. So the next special test I'll be doing is looking for laxity of the medial and lateral collateral ligaments. So Eva, just some more special tests for the small ligaments in your knee. Let me know if you do have any pain with this, okay?
Okay.
So with two hands, one hand supporting the patient's knee and one hand supporting the lower leg, I'm going to push medially, testing for laxity of the lateral collateral ligament, and then pull towards me, testing for laxity of the medial collateral ligament. I don't feel any laxity. I'll do the same on the other side. So again, supporting the patient's knee and supporting the lower leg. And I don't feel any laxity. The medial and lateral collateral ligaments appear to be intact bilaterally. And the last of the special tests is looking at the menisci. So there are a few tests here. We'll start with the McMurray's test. So Eva, I'm again doing some more special tests where I'll be twisting your knee a little bit, just gently though. Let me know if you feel any pain.
Okay.
Okay? While I'm doing this, I'm also feeling for any click with the motion. So starting with McMurray's test for the medial meniscus, supporting the patient's lower leg with one hand on the knee, I'm going to externally rotate the foot and apply a medial force on the lower leg while extending the knee, palpating for an audible click and assessing for any pain. Any pain with that?
No.
Excellent. Okay, next we'll do the lateral meniscus. So this time we're going to internally rotate the foot and apply a lateral force on the lower leg and extend in one smooth movement, feeling for an audible click and assessing for pain. Any pain with that?
No.
Excellent. And the final special test I'll be performing today is the Apley's compression test. This is another test for meniscal tears. So Eva, again, just let me know if you feel any pain with these movements, okay?
Okay.
So with the patient prone, I'm going to flex the knee to 90 degrees, stabilize the femur with my other hand, and with my free hand, I'm going to press downward over the patient's heel, rotating the leg internally and externally. Any pain with this?
No.
I'm also listening for any popping or clicking, which could indicate a meniscal tear. And then I can also apply a valgus force. Any popping, clicking, or pain with this would indicate a lateral meniscus tear. And a varus force. Any popping, pain, or clicking with this would indicate a medial meniscal tear. And that concludes the assessment of the menisci. So this concludes the knee exam for today. I'd just like to take a moment to thank my patient. Eva, thank you so much for coming in today. It's been a pleasure.
Thank you for doing the exam.
Great. So again, this has been the knee exam. I examined today Eva, 22-year-old healthy woman who had no abnormal findings on her knee exam. For more Stethopedia videos, check out the links below.